Hello there. So on Sunday, state after state has been announcing its own guidelines for what is going to be permitted and not permitted under Unlock 1. Although, to be honest, because there's been so much relaxation already, I'm not sure how much of a difference it's going to make in immediate terms. Yes, the curfew is going to be relaxed and things like that. Some of the big changes are going to start really from June the 8th, when shopping malls may well start opening in many, many states. They've said shopping malls could open, salons could open, spas perhaps could also open, religious places. Maybe not large religious gatherings, but religious places will also open from June the 8th onwards. Now, obviously, there is still confusion in a couple of areas. In the NCR, for example, Delhi, Gurgaon, Noida, because the states have been allowed to decide as to whether they are going to allow movement back or forth, an area like the NCR, where there are actually 3 states in very close proximity and it's almost one contiguous area, there is a lot of confusion as to whether people will be able to go back or forth, and clarification is required. And also, many people are asking the obvious question that, look, now as cases are continuing to mount, and remember yesterday was another 8,000 plus day in the number of cases. In terms of absolute cases, India is now number 4 in the world after only the US, Brazil, Russia, and then there comes India in absolute number of cases. So many people are actually asking the questions, why are we opening up so much now to the extent of allowing shopping malls and religious places? I guess the answer from the government's point of view would only be, we can't afford to be in lockdown forever. The economy is really, really in pain. You could quibble about some of these things. I mean, shopping malls will really make a difference or not make a difference. But I guess the thrust simply is, let the economy now try to heal itself, and we'll have to manage. We'll have to manage with the fact that the recovery rate is as good as it is. But let's just quickly bring you up to date with all the big stories on Sunday.
As the centre announced plans to ease restrictions across the country and bring it out of the coronavirus-induced lockdown, Prime Minister Narendra Modi had a word of caution for Indians in his monthly radio address, Mann Ki Baat. He said that people need to be more vigilant as the country attempts to return to normal in a phased manner, and there should be no laxity in maintaining social distancing and taking precautions.
अर्थव्यवस्था का एक बड़ा हिस्सा अब चल पड़ा है, खुल गया है। ऐसे में हमें और ज्यादा सतर्क रहने की आवश्यकता है। 2 गज की दूरी का नियम हो, मुंह पर मास्क लगाने की बात हो सके वहां तक घर में रहना हो, ये सारी बातों का पालन, उसमें जरा भी ढिलाई नहीं बरतनी चाहिए। देश में सबके सामूहिक प्रयासों से कोरोना के खिलाफ लड़ाई बहुत मजबूती से लड़ी जा रही है।
India reported another record high in COVID-19 cases with the biggest single-day jump of 8,380 fresh cases in the last 24 hours, which takes the total tally to 182,143 cases, according to the data shared by the Union Health Ministry on Sunday morning. The death toll has increased to 5,164 with 193 deaths in the last 24 hours. These alarming numbers come as curbs are being slowly relaxed, with the government announcing a phased unlock plan from June. 86,983 people have been cured, and with this the recovery rate in the country has gone slightly up to 47.75%.
The Delhi government has sought an immediate assistance of 5,000 crore rupees from the centre to pay salaries to its employees and meet its expenses, as revenues have dried up during the lockdown. Deputy Chief Minister Manish Sisodia, who also holds the finance portfolio, said he has written to Union Finance Minister Nirmala Sitharaman for help, adding that the Delhi government has not received the funds sanctioned to states under the Disaster Relief Fund. Sisodia said the state government needs 7,000 crore rupees for 2 months, and the first item of priority is to pay pending salaries. Due to the lockdown, the tax collection of the Delhi government is running low at about 85%.
Congress General Secretary Priyanka Gandhi has alleged that Shramik special trains were being ignored by the railways, due to which 40% were running late and many lost their way and 80 passengers died. She said the Railway Ministry says weak people should not travel, which is shocking. Nearly 75% of the special trains headed to UP and Bihar, and the rest to Eastern India.
Tamil Nadu government on Sunday announced an extension of the ongoing lockdown till June 30th, but with more relaxations that included partially opening up public transport and allowing more employees at the workplace. Public transport will resume with reduced services from June 1st, but buses will not be operated in Chennai, Kanchipuram, Tiruvallur and Chengalpet districts, having the highest concentration of COVID-19 cases in the state. All showrooms apart from those in malls like apparel, jewelry, etc. can open with 50% staff.
Actor Sonu Sood, who is earning a lot of praise for sending stranded migrant labourers to their homes amid the lockdown, met Maharashtra Governor Bhagat Singh Koshyari on Saturday at Raj Bhavan. The governor applauded Sonu for his work and assured him support. Sonu recently airlifted 177 women stuck in Kerala's Ernakulam amid the nationwide lockdown.
According to the World Health Organization, since COVID-19 primarily affects the lungs, smokers are at a higher risk of developing severe disease and death. Chewing tobacco, on the other hand, leads to increased production of saliva and thus the urge to spit. Spitting in public places could enhance the spread of the virus. Tobacco is also a major risk factor for heart disease, cancer and diabetes that put people with these conditions at higher risk for developing severe illness when affected by COVID-19. However, there are no peer-reviewed studies that evaluate the direct risk of COVID-19 with tobacco use. The WHO cautions that the act of smoking involves contact of fingers with the lips, which increases the possibility of transmission of viruses from hand to mouth. Smoking water pipes or e-cigarettes often involve the sharing of devices, mouthpieces and hoses, which could also facilitate the transmission. WHO recommends that if you smoke, now is a good time to quit completely. Within 2 to 12 weeks of quitting, circulation will improve and the lung function increases, says the health body.